I'm pleased to welcome you back to the third in a series entitled New CF. It reviews how the advent of CFTR modulator therapy has influenced the management of cystic fibrosis, with a focus on fat-soluble vitamin management when used in conjunction with modulators. This has resulted in new consensus-based guidance. The study is entitled New Consensus-Based Guidance for the Nutritional Management of Children with Cystic Fibrosis on ETI. So the study is broader than just fat-soluble vitamins, but that will be the focus of our discussion today. So what was the study aim? Well, it was to systemically review the literature on ETI and nutrition, to develop expert consensus-based recommendations, and highlight existing research gaps and priorities. There were 22 gastroenterologists, dietitians, respirologists, endocrinologists, and one parent representative in the field. They were required to have previously worked with CF-related guidelines and have at least 2 years experience in people with CF on ETI. And clearly the positioning of this new consensus-based guidance is clearly the result of ETI and its significant effect in altering the nutritional trajectory of children with cystic fibrosis. So let's talk a little bit about their methods and particularly the inclusion criteria and definitions. Well, as you look at the study, and it's available on our website, the word P refers to population, and that's defined as children with CF from birth to 21 years of age. The intervention, or I, is ETI. Comparison, C, people with CF on a different CFTR modulator, and I believe that number is 5% in the US, with the majority on ETI, but that's not the same in all countries. Those not on a CFTR modulator, or children without CF. And finally, outcome, or O. The group focused on aspects of nutritional status that the expert group identified as being affected either positively or negatively by the use of ETI with traditional CF-specific multivitamins. They included weight, height, and BMI, biochemical aspects, for example, vitamins, minerals, proteins, and lipids, diet, endocrine pancreatic status, exocrine pancreatic status, and ETI administration. Now, they used a grading system, and that's well defined in the methods section. And I'd encourage you to go to our website to take a look at Table 3, which really gets into a lot more detail about the 1+, the 2++, or 2+, and the 3 or 4 grading system. But grade A required at least one meta-analysis, systemic review, or randomized clinical trial rated as 1++, or a body of evidence rated as 1+. And as we get into the next couple of slides, you'll realize the body of evidence around this is actually quite small. And importantly, that in these cases, that it was directly applicable to the target population and showed consistent results. Grade B reflected a body of evidence rated as 2++ or 2, directly applicable to the target populations, again showing consistent results. Grade O reflected evidence rated as level 3 or 4. Again, Table 3, if you want to, take a look at our website for the full study. And where direct evidence was lacking, statements reflecting the clinical experience of the panel were formulated and designated as GPP, or good practice points. So let's look at the results. Well, first, as I've already inferred, the data was very limited. Just 28 full-text articles were available. And no studies reported on minerals, iron or sodium, diet, protein, or ETI administration. And let me add, the findings in this study and guidance apply to individuals 2 years of age and older. Again, 2 years of age and older. So what were the authors' conclusions and recommendations? Well, first, they suggested that vitamin A levels may increase significantly in children who receive ETI, with some evidence suggesting an elevated risk of hypervitaminosis, grade 0 with 100% in concurrence. With vitamin E, levels did not appear, based on the literature, to change significantly in children following ETI initiation or administration, a grade B, but again, 100%. D, levels in children receiving ETI were inconsistent, and most studies did not adequately, they offered, consider the effect of seasonality, which is a key factor in interpretation. So grade O, but 100%. And there currently is insufficient evidence to determine the effect of ETI on vitamin K status in children. Grade GPG, but 100%. So what they also added is, given the increased bioavailability of preformed vitamin A and the potential for toxicity in children on ETI, they should receive supplements containing predominantly provitamin A, beta-carotene. And the plasma/serum levels of A should be checked prior to initiating ETI and within 1 to 3 months post-initiation. And it's interesting because the earlier series that spoke to data spoke to within 3 months. The new consensus recommendations talk to 1 to 3 months post initiating modulator therapy. So let me go to the heading: new data, new guidance, and I should probably add, new products. ETI has significantly, I'm going to borrow from the consensus group. That's why this is in print. ETI significantly altered the nutritional trajectory of children with cystic fibrosis. And we know, in terms of outcomes based on the registry data, that life expectancy has dramatically changed for those who are eligible or taking a modulator. But ETI also introduces a need for a new level of monitoring of fat-soluble vitamin levels, and particularly vitamin A. And I would also add, not just monitoring, but potentially selection. Because the recommendation is for a multivitamin whose content is predominantly provitamin A or beta-carotene versus preformed. And as you look at some of the OTC products that are out there today, you may be surprised. But MVW Nutritionals brings a new, and I'll say novel, product to address the potential risk associated with vitamin A and multivitamin supplementation in CF for those taking modulators and those not. One developed predominantly with a provitamin A content, 96.5%. So, clearly with modulator therapy, there are new possibilities for individuals and families. There's a new guidance for monitoring, and let me suggest that there's a new option, a new product solution to address this new CF and some of the different outcomes we may face today in some individuals who are on modulators and also taking a CF-specific multivitamin. Let me thank you for your time today.